Welcome back to PBH435. This week we're going to be talking about tobacco for Chapter 10. As we move through our content on tobacco, we're going to start by talking about the history of tobacco around the world and how its use spread, and then move to the history of tobacco and tobacco control efforts here in the United States. Then we're going to dig into the health effects of tobacco, as we know there's some important adverse health effects we'll need to discuss here, as well as the effects of secondhand smoke, a very important public health topic when we talk about the health effects of tobacco. Then we'll talk about the actual effects of nicotine, both physiological and behavioral effects, and then finally move on to some of the information that we know about smoking cessation. Throughout the lecture, we're going to be addressing this idea of the tobacco dilemma. Tobacco is the most dangerous legal product in the United States. It's used by a significant proportion of adults, but it is really responsible for more adverse health consequences and deaths than any other drug that's available in the United States. So this is our most deadly and most dangerous, if we're going to talk about dangerous drugs, but it is entirely legal for most people in the United States once they reach the legal age to purchase cigarettes. So really interesting statement on our country's priorities in terms of drug use. So we're going to go back to the beginning. We're going to talk about early history of tobacco use, and that did involve Native Americans here in North America. It was cultivated and used for centuries, typically as part of religious ceremonies, and it did have ceremonial and important value in the culture, and was presented to Columbus when he arrived in North America in 1492 as a gift. He brought that product back, and the word that we now call the product tobacco was actually adopted from Spanish, and it was adopted, by the Spanish, and it was possibly from an Arabic word related to medicinal herbs. So it was actually, in its early days, considered a medicine. Its importance as a medication grew throughout the 16th century, and it was actually one of its earliest proponents was a French physician named Jean Nicot, and the active ingredient of nicotine and the plant genus are both named after him. So that's where we get the name nicotine, as well as tobacco. Throughout the 16th and 17th centuries, we see tobacco actually having a very positive reputation in terms of medical uses, but it was also widely viewed as negatively impacting reproduction. We finally see nicotine dropped from the U.S. list of medications in the 1890s, and it continued to be available as a recreational product after that. We do see two major species of tobacco that are grown today, out of about more than 60 in the genus. Nicotiana tabacum, which is the large leaf species that originated in South America, and then Nicotiana rustica, which is a small leaf species originally from the West Indies and eastern North America. So those are the two that are primarily grown and sold. We don't just, when we talk about nicotine, we tend to talk about cigarettes, but we do have multiple products that are included in this category. First, we've got snuff, which has definitely declined in use over the past century. In the 18th century, it was actually increasing as smoking tobacco decreased, but in the United States, it was perceived as a British product, kind of like tea, if you think about the Tea Party and that decline in consumption. So American use of this perceived British product did decline after the Revolutionary War. And then chewing tobacco. Actually, before the 20th century, most of the tobacco that was used in the United States was actually chewed. And smoking didn't really surpass chewing until the 1920s. So we've got some real changes in consumption patterns there. So moving on to the types of tobacco that are smoked, our two main categories here are cigars and cigarettes. And just a quick note about e-cigarettes or vaping, they typically do not contain any tobacco, which is why they would not be covered under a tobacco lecture here. So cigars and cigarettes. Cigars really peaked in popularity in 1920. But they have actually experienced a bit of resurgence over the past couple of years. And then cigarettes, these are actually based on a Native American method of smoking. And before the late 19th century, most people who smoked tobacco in this manner either used that Native American method with thin reeds or rolled their own cigarettes. But we first started seeing factories producing tobacco products in the 19th century. Towards the end, and as the process of smoking cigarettes became more convenient, where you didn't have to roll your own and have the supplies and that sort of thing, we saw the habit of smoking cigarettes begin to spread very widely until it became the most current form of tobacco use, which it actually still is. So just a little bit more information about cigarettes and their history. 1913 was was the introduction of Camels, which was one of our first domestic tobaccos, and because of its low price, it actually became quickly one of the most popular. In 1939, Pall Mall started the first king-size cigarette, so we're seeing tobacco become more available, tobacco become cheaper, and then available in larger quantities. And then in 1954, with some of the health news that was beginning to emerge, we saw Winston introduce filter cigarettes. So looking at the process of getting cheaper and bigger, and then the attempt to kind of health wash the effects of it. And now we're at a point where those filtered cigarettes constitute more than 90% of the U.S. cigarette market. Not true internationally, but here in the United States, over 90% of cigarettes are filtered. And of course, we know that there are some very serious health effects from smoking cigarettes, but actually, as far back as the 17th century, we've had some activists who suggested that smoking tobacco is hazardous, harmful to the brain, and dangerous to the lungs. But back to that tobacco dilemma, King James, who wrote that phrase, also supported the American tobacco trade because of the large amount of profit that it brought to the United Kingdom. So back to that dilemma, which is not a new development in tobacco sales. Some interesting cultural reference in the beginning of the 20th century, New York actually made it illegal for women to use tobacco in public, not in private, but in public, to protect them from themselves. So fortunately, we no longer have that attitude about women's choices, although some of us are beginning to feel like we might need to have that attitude about smokers in general. So interesting socio-cultural perspective on smoking there. Moving through the 20th century, we start to see more and more data that links smoking to cancer and respiratory disease. One of the first pieces of popular media to report on this was an article in Reader's Digest in 1952. So the tobacco companies at this point began their long process of denial, or over and over and over again, they have denied the connection between cigarette smoking and health risk. One of the things that they did was to form this organization, the Council for Tobacco Research, that tried to do competing studies and other ways to undermine the very clear data that was emerging in less prejudiced and biased research. Now, also in response to the claims that smoking was a health risk, they really kicked up their marketing of filtered cigarettes and cigarettes with lower tar and nicotine, promoted these as safer alternatives to more traditional cigarettes. If you were a Mad Men fan, you probably saw some episodes related to cigarette companies trying to change the way that their products were marketed in order to overcome the bad health news that was being released. So moving forward into the mid-20th century, we start to see that health news become more and more high priority and more clear. In 1964, we get our first Surgeon General's report that states that smoking causes lung cancer. And it's actually stated in men because that was the research population. It wasn't that women were immune, it was just that the research was only done with men. And we saw that long decline that's demonstrated in the chart on the right. So starting with smoking rates in 1945, we saw a really rapid increase related to two things. First of all, increased standard of living that allowed more people to purchase cigarettes, and then also the fact that cigarettes were actually distributed for free to American soldiers who were participating in World War II. So if they were deployed, they received free cigarettes as part of their compensation. So we saw rates of smoking increase in those populations as well. In 1965, based on the Surgeon General's report, Congress required warning labels, which we still see today. So you can see the peak on the blue line, that's per capita sales of cigarettes, was really in the the early 1960s before that report was issued, while the peak in sales didn't actually occur until the the early 1980s. So that's related to increased cost for cigarettes as well. Okay, so we move on into the later 20th century, and we start to see limitations on how tobacco can be marketed. No TV or radio ads for cigarettes, and then in 1990, before that, still legal to smoke on domestic airline flights. So it's a pretty recent development. When we talk about changing social norms in public health, tobacco is our biggest example. If we think back to maybe 1950, and then forward to the turn of the century, you can see some really dramatic changes that occurred just within a lifetime. In 1995, we see further regulation of tobacco and ads, and then, of course, many states and localities have passed their own bans, things like Clean Air Acts and other kinds of smoking limitations. So another approach that was used was the legal approach, where folks who had been smoking and suffering the health consequences started to sue the tobacco companies to be reimbursed for their health consequences. This attempt was unsuccessful for quite a while, but then the tide started to turn, and there were several large awards and victories that came out of those legal efforts. In 1998, we saw the Master Settlement Agreement. This was an agreement between 46 states and the major tobacco companies that resulted in over $200 billion in payments to states to compensate for the healthcare costs that the states had dispersed for the health problems of smokers. Now, actually, it's gone to fund a number of programs, including some of the funding for the Millennium Scholarship Program. So if you're on a Millennium Scholarship, it goes back to the Master Settlement Agreement. Some of the reasons why we think that tide changed had to do with a changing legal climate, just in terms of tort lawsuits. And then also we started to see the quote-unquote smoking guns from the tobacco companies, where they actually knew, despite the fact that they said they did not, about the dangerous health effects of smoking, but continued to lie about it, and even though the data was included in their records. I'm going to show you a quick video, famous speech before Congress. All right, here's the video. So this is 1994 at a congressional hearing about tobacco and tobacco use.
Let me begin my questioning on the matter of whether or not nicotine is addictive. Let me ask you first, I'd like to just go down the row, whether each of you believes that nicotine is not addictive. I heard virtually all of you touch on it. Just yes or no. Do you believe nicotine is not addictive?
I believe nicotine is not addictive, yes.
Mr. Johnston?
Congressman, cigarettes and nicotine clearly do not meet the classic definitions of addiction. There is no intoxication.
We'll take that as a no, and again, time is short. If you could just, I think each of you believe nicotine is not addictive. We just would like to have this for the record.
I don't believe that nicotine or our products are addictive.
I believe nicotine is not addictive.
I believe that nicotine is not addictive.
I believe that nicotine is not addictive.
And I do believe that nicotine is not addictive.
Dr. Campbell, I assume that you're aware that you're...
Okay, so that was the heads of the major tobacco companies testifying before Congress that they believed their products were not addictive. And what started to emerge as the legal environment changed was that they actually had done their own research that indicated that it was. So this basically this process of perjuring themselves in front of Congress is something that tobacco companies, a strategy they've continued to pursue through funding their own kind of biased research and then not fully reporting the results of the research that they've done on their own as well. So part of the result of this was this quest for quote-unquote safer cigarettes. So we're going to answer that last question first. Safer does not mean safe. Making cigarettes with lower levels of nicotine just causes people to adjust their smoking behavior, taking more puffs and inhaling more deeply. And actually the same thing with lower levels of tar. That in switching to a low tar cigarette, people also change that behavior of inhaling and puffing. And so we don't end up with really any change in health risk based on the actual makeup of the cigarette. So that will wrap us up for our first lecture. We'll be back for lecture 2 to talk about use patterns.